Hello, my name is Carol Neer, RN. I work for Genesis Occupational Health, and I'm here today to be administering the COVID vaccines, which I find very exciting and landmark. Landmark. I remember 60 years ago when I was 10 and when the polio vaccine became available, and now it's 60 years later, and this landmark vaccine is now available to healthcare workers and soon to the public. I'm very proud and excited to be here, to be a part of this.
Perfect. So back when the polio vaccine became available, what was that like?
You know, at 10 years old, I didn't really think. I remember seeing pictures of my friends' parents being scared for their children, but it was on a sugar cube. And I remember going to this mobile building and walking in one door and going out the other, and they give you a little sugar cube with this sweet taste, well, the pink color on a sugar cube.
Perfect. So today you're going to be administering the vaccine. What is that like today versus back when the polio vaccine was available, and today with the COVID vaccine being available?
I'm more aware of what it's been doing to people, and just very, to me, it's just groundbreaking landmark event.
Perfect. So what have these, as an RN, what have the past couple of months been like for you?
Well, I only work per diem, so I'm not on the front line like many of my friends and coworkers, but it's been scary. I've gone out and done flu shots out in the community and had to wear a mask, and just scary.
From your coworkers' perspectives, have you heard any stories that you would like to share or have people know about for the past couple of months?
Just the fatigue and the tiredness, and watching patients pass away without their families at the bedside.
So what can you tell to anyone that is looking to get the vaccine here as soon as they can?
I would say go get it. When it becomes available to the general public, I would say get it. Let's fight this.
Perfect. Thank you so much.
Okay, thank you.
So we talked about the vaccine today, but can we talk about kind of the travesty that happened, or just the hard times with the polio vaccine back then and the hard times that we've hit now currently? What are the differences that you've seen, and what has been kind of the same?
Well, from my memory, I seem to remember children being more affected by polio than all age groups with COVID. I remember the visions on TV, the pictures on TV. Of course, it was all in black and white back then, but seeing wards of children in iron lungs. And my friend had a friend that was at home in an iron lung. And I remember the parents, my mom was worried every time I'd complain of an ache in my leg or something. Parents were worried that their children had contracted polio. But those visions are always going to be in my head because of my age. Being 69 years old, I can remember seeing those pictures.
So seeing those pictures back then and seeing images today, what do you think the difference is, and what are the similarities?
The difference is, the main difference to me is it's affecting adults much more at a higher rate than children. But similarities are the tragedy. Another difference is the COVID are being isolated. And I don't remember ever seeing people wearing masks in those pictures or film newsreels. I don't remember seeing people wearing masks back then. But it's frightening.
So do you think the isolation today, it's different than back then? What do you think the isolation does for people now?
Scary, loneliness, and You know, there's people dying that don't get to see their families. And, you know, until, you know, the last hours, they're allowed to come in. But I think that, and again, I can't say personally I was ever involved with anyone with polio. It's just the images I have in my mind from back then. But we're seeing and hearing so much more, and media is so different now too. I mean, you can turn the TV on any time of day and night, and you can see images of what's going on,
Definitely.
and it's broadcast more.
Definitely.